Yeah. Hi. So before I'm gonna come in, we're gonna go and close the thing for privacy. I'm introducing myself. Hi, Mr. Smith. My name's Jesse. I'll be your nurse today. How are you? Good. Okay. Hey. So per the doctor's orders, we have to do an NG tube on you. Would that be okay with you? Yeah. Okay. Before we get started, you give me your first name, last name, date of birth. Also, as I'm looking at the patient's nose, I don't see any. I don't see a nosebleed. I don't see any discoloration. I don't see any aspirations or nasal polyps.
Because 6 through here is going to be really dry.
As I'm looking up the nose with my pen light, as I'm assessing the nose, I don't see any sort of drainage. As I'm assessing the bilateral patency, can you breathe in and breathe out for me, please? 1, 2. Thank you, Mr. Smith. Also breathe in and breathe out. Okay, so as I'm looking at the bilateral patency is normal. Okay, so I'm gonna get started. So before I get started, I'm gonna put my hand hygiene, wash my hands, wait for 20 seconds, and then I'm gonna put on my clean gloves.
I'm gonna pick this up, both sterile, right?
Okay. Okay, so, and I did tell you that the reason why we're doing this is for doctor's orders, okay? So that's a rational. Do you have any questions before we get started? No questions? Okay. You might feel a little bit of discomfort, but it's normal. But if you need me to stop at any moment, then I will do so, okay? Okay. Also, before I get started, so I'm gonna check your bowel movements and also your lung sounds. Okay. So I'm gonna check for bowel movements. I'm gonna check the right.
Right, we got action going.
I'm gonna check the
and then I'm just gonna loosen
the right
this up,
lower,
making sure I don't touch
right upper,
catheter to anything.
left upper, left lower. So now that I finished checking the bowel sounds, I'm gonna check the lungs. First we're gonna do the posterior view, the posterior. So breathe in and breathe out for me. 1, 2. Breathe in and breathe out. 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 Okay. That was the anterior view. Now I'm gonna do the posterior view. So it's gonna be breathe in, breathe out for me, please. 1, 2. Breathe in, breathe out. 1, 2. Breathe in, breathe out. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. Okay, so now that I've assessed the anterior view, I listened 6 times. I've checked the posterior view. That'll be 8 times. So now that I've done that, I can get ready to do my G-tube placement. So now that I'm going to measure, I'm going to do it from the tip of the nose to the bottom of the earlobe, all the way down to the xiphoid process. So now that I looked at it, looks like it's 55 centimeters. Okay, so this looks like a good placement for the patient. So now that I have my measurements, I'm just going to put it in lube, which I have it right here. Just put it in lube. And then I'm going to have another nurse on the side that will help assist me with giving him a glass of water. Okay. Okay. So we're gonna go and make sure that his head is down. Make sure your Mr. Smith head is down. Okay. Hi, Mr. Smith. So I'm just gonna put this in there, okay? So I have my other nurse who's gonna have a glass of water next to you. I'm gonna put it in there. I just need you to gulp it, okay?
If you guys have grandma with a trach at home, go ahead and suction her for me. But if you don't have a grandma with a trach at home, you gotta do it in person or a video.
Okay, so I'm gonna put it in. Okay, so you're gonna feel. So I'm gonna put it in there. Okay, so I'm gonna do 1, 2, 3, and we'll put it in. Okay, 1, 2, 3. Okay, good job. So can you take a sip of water for me? As he's sipping the patient is sipping the water, I feel resistance. I can look down the throat and I can see that there. I can see the tube down there. Gulp for me, please.
I probably would have just done it on my leg and drew something.
Okay, I know it's a little uncomfortable, Mr. Smith. Okay, so I'm gonna hold this. I'm gonna get my tape.
I wasn't gonna follow all of the instructions.
Okay, thank you, Mr. Smith. Okay, so I'm gonna put this here.
I got a what? And I was like, stop drinking. I told you were gonna do the assessment. He's
Okay.
like, I can still. And I was like, your face
So I'm gonna
is
put
so
that
red.
there.
You have to have your shirt off. They had to have the shirt off and everything. I don't do the assessment. I was like, your face looks like a tomato, and then your body looks just white. What happened? Like, I was like,
Okay, so now I'm here. It looks like the G2 placement is good.
and I was like, yeah, I was like, and then I was like, I couldn't hit the reflexes. So I like paused the video and I was like,
Okay, so that's done.
so that was like a bunch of retakes. Yeah, so like I hit it and then it'd be delayed.
So
And I was like,
now that I've done that, so now I'm just gonna put in another piece of tape over just to secure my G-tube. Okay, now that that's done, thank you, Mr. Smith. Okay, so now I'm just gonna go and assess. I'm gonna listen for lung sounds again. Mr. Smith, I'm gonna check your lungs. Okay, breathe in and breathe out for me, please. 1, 2. Breathe in and breathe out. 1, 2. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay, now that I've checked the anterior lung sounds, now I'm going to turn around to the posterior. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. We've checked the anterior and posterior, 6 in the anterior, 8 in the posterior again, just to check the lung sounds all over again after we've put in the G-tube. Okay, so now that I've done that, so this actually doesn't come out. So I'm just gonna assume that we're gonna, for the video's sake, assume that this came out and I'm able to put blow air right into it since it's like stuck. Okay, so I'm gonna blow air into this. I'm just gonna go blow air into it, and when I do that, I'm gonna have the nurse, my assistant nurse, listen to the abdomen for swishing noises. Okay, so I'm just gonna blow air. Okay, thank you. My nurse confirmed that there is swishing noise in there. Also, now I'm gonna pull out some content out of the G-tube because I want to check the pH. Okay, so maybe I should hold this still. I have a pH strip here. I'm gonna put the content on the pH strip, and then I'm gonna go and dislodge all the content back in. So I'm gonna do that slowly. Okay, so now that I have that done, I've checked the pH. We've checked the lung sounds. Well, now I'll have X-ray. I'm gonna give them a call just to make sure that we want to make sure that the G-tube is in place. Okay, so now we're gonna do the suctioning.
If we come back like on a Monday to do the recording, is lab going to be open, or do we have to sign up for today? Let me go
Okay. So now that I've checked the placement, now I'm just going to go and clean a little bit around here, make sure that there's no exudate, make sure there's no type of there's no fluids. Just gonna go and clean around there. Okay, so now that my G-tube is fastened, now I'm going to do a G-tube removal. So I'm gonna put on a new set of gloves. I'm gonna wash my hands. So I'm gonna put a new set of gloves. So I'm just gonna go and take up the tape. 1. Take off the tape.
Are you guys doing it in Environment City? I saw that too. For the clinical?
Okay, so now that I've taken off the tape, Mr. Smith, I'm just gonna pull it out, okay? On a count of 3, I'm gonna pull it out. 1, 2, 3. Okay, thanks, Mr. Smith. Thank you for that. So now I'm just gonna go and throw this away. And then I'll clean my area to make sure that everything's clean. I'll perform hand hygiene. I'll make sure that the bed rails are up, the bed is at the lowest position, call light is within reach, and I'll make sure that the bed is locked. Is that?
That's it?
Yeah, I think that's it.